And our third speaker in this first session this morning is Professor Alan Miller, who I associate with human rights. I think of him as Scotland's human rights expert and champion. I first worked with Alan about a decade ago when he was the inaugural chair of the Scottish Human Rights Commission, and I was at the time Chief Inspector of Prisons for Scotland, and we worked to introduce a human rights-based inspection standards for prisons. Alan is Professor of Practice in Human Rights and at the University of Strathclyde. But he's here this morning as the independent chair of the National Collaborative for Scotland's National Drugs Mission. So I'm delighted to introduce Professor Alan Miller.
Well, thanks very much, David, for the introduction. And boy, is it good to be all together again after a couple of years of not being able to. And I heard some house rules being introduced earlier on, and maybe there's an extra house rule that could be introduced that no one needs say, "You're on mute." We're here together, and it's straightforward communications and connections with each other. First of all, I'd like to thank SDF for inviting me to participate in this very important event today, and I look forward to listening and learning as much as I need to, as I know I do, over the course of the event. I'd like to thank David, not just for chairing this event, and also Fiona for the legacy that they have left and the valuable support they have provided to the National Collaborative to build upon the recommendations that have come out from the task force. And I'll speak a little bit more about how the Collaborative will carry out its work in the time that I have available to me. I also would like to thank the Minister. I think that she has demonstrated and committed again to having a willingness and a humility to listen and to be challenged. I appreciate the support she publicly has given to the National Collaborative, and I look forward to working with her, and I'll certainly take her up on her willingness to be challenged. You can be sure of that. But as I look around you all, there are a few faces, but quite a few that I recognize. And therefore, in a strange but very welcome sense, given my age, I feel very much like a new kid on the block in terms of making some kind of contribution to what we're all here to find progress with today. There's so much experience and expertise out there that I really do feel like a new kid on the block. But as you can see from my appearance, I can hardly be described as a new kid. And in fact, it was First Minister invited me to lead a process to lay the foundations of this national collaborative, which is to bring a human rights-based approach to the national mission. Due to my having been around the block a few times and putting into practice in different contexts a human rights-based approach to address problems both in Scotland and internationally with the UN. So when she invited me to take up this role, I was very happy to do so and welcomed the opportunity because I go back in this. I have some history in this area. In the 80s and 90s, at the height of the war on drugs, I ran a community legal aid practice in Castlemilk for about 15 years. And day and daily, I was in the courts doing my best to support and represent those who were using drugs but who were being criminalized. And going to the prisons day and daily to follow up and try and check up on those that had been sent to prison and see what they were doing and if there was anything that could be done that I could help with. And it was very difficult, and I knew far too many who lost their lives either in prison or in the community needlessly as a result of how the criminal justice approach towards drugs completely failed. So when the First Minister asked me to think about taking up this role, because it was now seen no longer as a war on drugs, but as a public health emergency, I warmly accepted, because I see it not only as a public health emergency, but as a human rights emergency, and I'll say a few words about that. So, as part of a human rights-based approach, and as part of being asked to lay the foundations of the National Collaborative, which I'll speak a bit about, those people with lived and living experience will be in with the bricks of the foundation of the National Collaborative. Not just their lived or living experience, important as that is, not just their voices being amplified and raised, but also their rights, which have not been sufficiently recognized, but will be, based on the recognition of the value of the human dignity of each and every one of us, and the need to have rights in order to express and enjoy that human dignity that each of us is entitled to. In the time available to me, I'd like to say a few words about three things. Number one, what will the National Collaborative bring to the national mission? Number two, when will you see it begin its work? And three, how can you take part? How can you participate in the collaborative and strengthen your own work as a result of doing that? So on the first question, what will the collaborative bring? It will bring quite explicitly a human rights-based approach. So what does all that mean? Well, let me begin. The first thing it means is that it will empower all those affected by problem substance use to exercise their rights, which will be introduced through a human rights bill coming to the current session of the Scottish Parliament. For example, this bill, which will bring into our law, our policy and practice, a whole range of internationally recognised rights from UN treaties. For the first time in the UK, Scotland is taking the initiative. It will bring in such rights as the right to the highest attainable standard of physical and mental health. Now, what does that mean when you begin to break it down? Well, it means that drug and alcohol support services will have to change. They will have to improve. And the way in which they will have to improve is that they will have to meet certain standards, internationally recognized and now being brought into our law. First of all, there has to be a sufficient availability of different kinds of alcohol and drug support services. So offering a choice as to what works for an individual. And we've heard before this morning about abstinence recovery, harm reduction, whatever works for the person and whatever that person wants at this stage of their journey, they have to be made available. Secondly, they have to be accessible. They can't just be behind some door somewhere or referred to in Parliament as existing. They have to actually be accessible to people. And so that means really effectively tackling the stigma that prevents so many people from being able to effectively access the services to which they're entitled, and also influences the way in which they're treated when they do access the services that are available. And then thirdly, the services have to be acceptable. And that means acceptable to the whole range of different kinds of people who will want to and need to and have the right to access a service that works for them. So no matter what their background is, no matter what their identity is, the service has to be tailored, has to be person-centered, that it fits with where they're coming from and what they need to get from the service. And then finally, it has to be of a sufficient quality. It has to go beyond, but certainly include, a medical and clinical assessment, evidence-based, but has to see the person for who they are, why they're there, where they came from, the whole person, and not just that clinical, medical part of the person. It has to be both. It has to be the big picture and the whole person that is seen. And person-centered is an understanding that most of us have. And the other thing the Human Rights Bill will do, and I've been playing a part in leading the preparations for it, is that it will introduce rights that will address at least some of the reasons, some of the social determinants as to how individuals have come to develop problem substance use. So not just dealing with the symptoms that are brought to a GP or but how can we actually get to the bottom, get to the roots of this and prevent this continuing or even escalating, given all the pressures that are on people. So it will introduce rights, again, from the internationally recognized UN treaties, the right to an adequate standard of living, including adequate food, adequate housing. It will introduce the right to adequate social security, the right to a healthy environment. So not waving a wand that overnight, everything is a panacea, but setting the priorities, the political priorities, that will be sustained. And not just for this national mission or that national mission for so many years, but actually integrating, mainstreaming drugs and alcohol service support into the very fabric of our country as a priority that therefore demands adequate resource allocation to progressively realize these rights and ensure that there is a minimum below which no one falls in terms of the access that they have to services. So it will empower people. The other thing it will do is it will increase accountability of all decision makers, or what we call duty bearers, at all levels of government, in order that they implement the new framework and people are able to exercise their rights therefore. So the MAT standards and the proposals from the Drugs Death Task Force will be integrated into a framework of values of human dignity and of laws and of rights and duties to increase the accountability and the ability of people to exercise the rights that the bill will provide them. So the collaborative will lead a process for what we call rights holders, people affected by problem substance use, and duty bearers, those in positions of power who make decisions from the GP right up to the minister. It will lead a process where they will co-design a charter of rights for people affected by problem substance use. So taking the right to health, for example, what does that mean on an everyday basis trying to access alcohol and drug support services? What should you expect? And what should therefore the standards be that those with that position of responsibility to provide services have to meet? So a Charter of Rights will be co-designed in order to bring everyone together in a constructive, shared way to make the progress that's required. And then there will also be co-designed an implementation framework, because there's no point in having rights on paper if they can't be made real in people's everyday experience. And so, again, the collaborative will lead a process of bringing together rights holders, duty bearers, to co-design an implementation framework. What will that include? It will include things like models of best practice in how those with lived and living experience can participate in the decision-making locally or the delivery of services and improve upon the present efforts with LLE panels, etc. Workforce development training is essential in order that the culture changes and the power shifts. And then also knowing that there will nevertheless be a need to give teeth to these rights. There has to be independent advocacy and an effective complaints procedure, that a problem is able to be resolved quickly where it actually happens. There also will need to be monitoring and evaluation. So the inspectorates, with David's previous field, apply a human rights approach to scrutinizing how these services are being delivered. Are they implementing the framework that's going to be introduced? If not, why not? What systemically needs to be changed in order to improve performance? And recognizing that will not all work perfectly. We're all humans. Mistakes will be made. People will be slow or resistant to change that needs to be made. There has to be access to a legal remedy as a backstop. And that will also shift the power that those in positions of authority know actually this matters. They can actually be challenged. So you will have chief executives and others paying more attention to what's happening on a day-to-day basis in the ADPs, etc. So all of this will be done to align with the National Care Service that's coming in so that it is mainstream, it's sustained, and is not just dependent upon who's First Minister or how long a national mission runs for. The second question I want to say a few words about then is when will all this begin? This may sound all very good, but when will we actually see, and what's the kind of timeline for this? Well, I took up this post in January of this year, and between January and June, I went about meeting as many people and organisations as I could, those with living experience, advocacy bodies, organisations, service providers, government officials, health experts, to try and get a feel of what a human rights-based approach needed to be within this sector. And then I say we, it sounds very grand, with a small number of officials supporting me, put out a roadmap for consultation. This is what we think a human rights-based approach needs to look like in the circumstances that we're in. And we asked what people thought about that. And people gave a lot of responses, some of it very, very challenging. We took all that into account, reworked it, put it back out again, and it got very broad support, and therefore was broadly agreed by the end of June. Some of you may have been involved in that, but I would be very happy to hear from you if you haven't been. Then at the end of June, we put out a call for nominations for individuals who wanted to play a part in the first steps of the National Collaborative. Concretely, that meant we're going to have what we call a change team. So 15 to 20 people, the majority of whom will be of lived and living experience, to be the engine room, to really be those that will take the responsibility for co-designing this Charter of Rights and implementation framework. And the response has been very, very positive. In fact, I think I'm spending most of next week having one-to-ones with around 50 individuals who have put their hands up and said, this is something we'd like to be involved in. We also asked for reference groups. So those existing organizations that want to play a part in the implementation of the roadmap. So I'm very happy at a meeting with the SDF Living Experience Network, and that's the kind of body that would be a valued reference group that can influence the collaborative and make sure that its feet are on the ground in terms of what is happening. We also want to create, over the next few months, a space for everyone, particularly those of lived and living experience. The sort of working title of it, but that can be changed, is a leadership and learning network for a number of reasons. But one is to enable anyone and everyone to take part in the national collaborative process, to influence it, to bring their own experience and expertise, to raise their voices and challenge the national mission or anything that needs to be challenged and needs to be improved and solutions found. And the collaborative will amplify that and, to use the phrase, speak truth to power, bring that to the Minister and to the First Minister, straight from those who are coming from everyday experience of saying, this is the problem and these are better solutions that you should be thinking about. We want to also provide the collaborative with the means of consulting with everybody. This is what we're doing. This is what the Charter of Rights is beginning to look like. What do you think? Is this real? Or how could it be strengthened? So to have that two-way communication at all times. And then simply to learn from each other. Everyone is doing all kinds of different things in different ways in different parts of the country. There's a lot of learning, a lot of sharing that needs to be done, and a lot of leadership and where good practice is being seen, that others can learn from that, and it can be adapted or scaled up on a nationwide basis. And then the roadmap implementation itself will begin on, we hope, we'll be ready on December 10th, International Human Rights Day. So we will have the reference groups in place, we will have the change team in place. This network, I hope to have a meeting of interested individuals and bodies next month, or October rather, to shape that up. And then there will be a series of events and discussions over the next few months between October and December on just spreading the word. What is the National Collaborative? How can you participate? What is a human rights-based approach? How are we going to go about co-designing this Charter of Rights and implementation framework, just to popularize that quite widely. And we hope that by the end of 2023, we will have a clear set of recommendations as to the Charter and the implementation framework. And then finally, how can you participate? How can you be part of this? There's multiple ways. The change team is one, reference groups, this leadership and learning network, and over the next few months there'll be opportunities to take part in these discussions that I've been referring to about human rights, the Charter of Rights, etc. And I'd encourage you to participate either as individuals or through your own networks and organizations like SDF. So, a bit of a quick run around the houses. Many thanks for your time. I look forward to working with as many of you as possible on the progress that is needed, sustainable basis and a national basis, but most importantly, needed urgently. And so many thanks for your time.